Well, the National Council Against Smoking has warned that smoking and exposure to secondhand smoke can increase your vulnerability to infections like COVID-19. Studies of the progression of COVID-19 induced pneumonia among Chinese patients indicate higher levels of illness in patients with a history of smoking. Well, in South Africa, there are currently 24 confirmed cases of the virus. To help us discuss this a little bit more, we're now joined in studio by Dr Sharon Nyatsanza, who's the Project and Communications Manager at the National Council Against Smoking. Thanks very much for joining us. Good to have you on the program again.
Thank you, Peter.
All right, so we're talking about COVID-19, but I guess smoking has an impact on all kinds of viruses.
Okay, so thank you for the opportunity. So smoking does not cause the COVID-19, virus or the infection itself. So it's very important for us to emphasize that it doesn't cause the COVID-19. But what it does is, because smoking damages almost all the organs of the body, it weakens the immune system. So what we now have, when we have a weakened immune system, the body does not actually fight infections as well as it does when the immune system is okay. So we have a case where people who are exposed to tobacco smoke actually can be more susceptible or vulnerable to getting the virus, and when even they get infected, the symptoms can be more severe. They can be worse compared to people with a stronger immune system, which can actually fight off infections.
And also, I guess, what we've now know is that COVID-19 and some of these viruses are respiratory. And smoking particularly targets, it affects all organs, as you say, but it goes through the respiratory system.
Yes. So we have a virus like COVID-19, as it actually targets the respiratory tract. And when we have, chemicals from tobacco actually also target the same, parts of the body, the breathing system. So we see that people, sometimes when you smoke, you cough a lot more, you can have lung damage. So, that is, the similarity between these two. So when we have, viruses like, COVID-19, then the public health community does get worried. So the World Health Organization actually has, it has encouraged countries to, to inform the public of the linkages between smoking and COVID-19. But so, for example, we have a study in China that was done. So in this study, they were trying to investigate, the disease progression of COVID-19 induced pneumonia. And one of the factors that they found in patients whose symptoms were worse or whose symptoms were actually taking longer to get better is a history of smoking. And this is one of the things that we want the public to be aware of. So we have the COVID-19 now, but even with the previous kind of coronavirus that we have had, like the MERS in 2012, there's evidence which actually shows that people who were exposed to tobacco smoke were more more vulnerable to the disease.
And China is a good place to study this because there's a high consumption rate of smoke and tobacco there. All right, so what if I stop smoking? Am I still more vulnerable than the next person, or is there a process where your body can start to build up its immunity?
Okay, so with smoking, the good thing is when you actually quit, when you stop smoking, the benefits are actually almost immediate. And it's very important to know that even though we're talking about COVID-19, stopping smoking has health benefits which actually go beyond the COVID-19. So, for example, after a day, your risk of a heart attack actually decreases. After 2 weeks, 14 days, already your lungs actually function 30% much better. When you stop smoking, within the first 12 hours already, your oxygen levels actually are rising already. So yes, this is an issue of vulnerability, but still, a lot of people are actually vulnerable. Like right now, science is also showing that people who are older are vulnerable. People with heart disease are vulnerable. So when the benefits of stopping smoking should go beyond, the COVID-19
right.
virus.
Remind us, what is it about smoking that is so damaging? Just the thought of smoke getting into one's body, that's already, I think, quite obvious. Is it the smoke? Is it the nicotine? We know that causes addictions as well. What is it about the smoking process, and how does it damage the body?
The body. So the complicated thing about smoking is that it actually affects all the organs of the body. So yes, nicotine is dangerous. It's addictive, but even things like tar. So we have over 7,000 chemicals in tobacco. We have 70 which cause cancer alone. So the thing with smoking is it affects, it causes more than 17 types of cancer. It causes heart disease. It increases your chances of getting TB. It can make, TB treatment less effective. It can even make ARVs less effective. So, it's linked to too many diseases. It also linked to diabetes. So the thing about smoking is we have over 7,000 chemicals, and it depends obviously from person to person. Some do get this disease, some get that, some actually get more than one kind of disease.
All right, so we're talking about damaging the immune system and suppressing it with the use of tobacco. Cigarettes is what we have in mind, but does this apply to Hubblies and these other contraptions that young people particularly using?
So in the context of COVID-19, one particular kind of tobacco that has been studied in the past few weeks is the Hubbly. And the World Health Organization has cautioned that countries actually stop public use of Hubblies, because as we know now, COVID-19 is transmitted via the droplets. So when, for example, we share a Hubbly, me and you, if I'm infected, then you are at higher risk of infection. Right. So when you talk about smoking, yes, we have used it. We have more focused on cigarettes, but tobacco in all its forms. So we're talking about Hubblies, we're talking about cigar, we're talking about snuff, we're talking about people who don't smoke as well. People who actually are exposed to second-hand smoking. We're talking about tobacco in all its forms. Yeah. And recently now we're talking also about e-cigarettes. Although we still debate about the safety level of e-cigarettes. Again, studies are showing that e-cigarettes are linked to heart disease. They are linked to respiratory disease as well.
All right, so don't share these Hubblies, because that's already a line of danger. All right, so I suppose in the end, bottom line, don't smoke, even without COVID-19. But the fact that it's there, you don't want to depress your immune system even more.
Yes, definitely. So definitely, we encourage people to stop smoking, beyond COVID-19, and because it's basically about the immune system. So it's not only about this virus, but it's also about other diseases, other viruses as well.
All right. Dr. Sharon Nyatsanza, always a pleasure talking to you. I don't think we need to say how important these conversations are, but especially in this environment that we're in, I think anything that can help us improve our chances of health is a good one. So stop smoking if you are able to. Thanks so much, Dr. Sharon.
Thank you for having us. Okay.